Hello and welcome. My name is Jiri Svoboda and this is another episode of the EuroHealth podcast where we discuss key healthcare topics in the European Union. Usually at this very spot there will be a guest with me, but not today. We are at the end of 2024 and also in the middle of the third season of our podcast. So we thought that's a good moment to pause and do two things. First, reflect on the episodes we have done this year, and second, review key moments of the 2024 in the European healthcare policies. Let's start with a short overview of episodes we covered this year. Throughout the second half of the year, Hungary held the presidency in the Council of the EU, and health was also one of the key topics. Hungarians wanted to focus also on cardiovascular diseases and their treatment. Previously, much of the focus in the EU was on oncology, but that's now changing. We spoke with Judith Bidlo, Hungarian Deputy State Secretary for Professional Management of Health at the Ministry of the Interior.
But I think now we are on the point we have to sustain the oncology healthcare system as it is now. But there is a huge need for improvement in cardiovascular diseases. Approximately 3 times more patients die every year because of cardiovascular diseases than oncology diseases. And we do not focus enough on the prevention and the holistic approach of the cardiovascular diseases. And this is why we think that we should focus on that now.
One of the key topics of the EuroHealth podcast was also harm reduction approach to drug policies. That sometimes clashes with politicians who often have tendencies to be more restrictive, despite the scientific evidence. We discussed this disparity with Professor Viktor Mravčík, head of science at the Institute for Rational Addiction Policies. So if the harm reduction policies work so well, and we have the evidence for it, why are some politicians in some countries are still very much opposed and still decide to go more in the restrictive approach? Is it just ideology or what's happening there?
Yeah, ideology is there from the beginning. And as I said, with some campaigns in 70s, 80s, it was even strengthened. This securitization of drug policy when the problem, which is in principle public health, is presented and at political level dealt as the security problem, which in principle is not. They call it also in research drug crime nexus. Drug problem is presented as a criminal problem of criminal organizations, international criminal organization, and so on and so on. And then the logic answer, following that logic, is the strengthening, militarization of the response.
Harm reduction was also one of the main topics in the interview with Dr. Jane Montané. She is the head of Public Health Union at the European Union Drugs Agency, which recently evolved from EMCDDA. Even though there are differences in policies across member states, the common legislature can still serve as an inspiration.
We are able, interestingly, to talk about a common approach. So there is, as I say, a strategy and action plan. All 27 member states have signed up to. Quite high level, but it's got a lot of, it's got a lot of detail in it. And one of the things that's actually particularly interesting is the European approach, again, on the global stage, is a balanced approach, which is quite helpful when we're talking internationally. So the supply and demand are both seen as key components. But particularly important for Europe is we also have harm reduction as a component of our European drug strategy. And again, that's quite novel and is something that's come a lot later in other countries.
Moving on, the main topic of another episode was Europe's plan on beating cancer. Of course, tobacco usage contributes to cancer significantly. The plan therefore dictates quite an ambitious goal to achieve tobacco-free Europe. One of the key architects of the plan is Philippe Roux from the European Commission's Directorate General for Health and Food Safety. We asked how does he want to achieve tobacco-free Europe?
The way to achieve this goal is to cooperate with the member states in order to create the environment that, on the one hand, makes it more difficult to use tobacco and to protect people from the use of tobacco by others. So that's, for instance, all the rules that have been put in place to forbid smoking in public environments, and the enlargement of these public environments, and our work at international level in the FCTC, which indeed where the union has a relatively strong position to protect citizens and young people from tobacco use. So cooperation with the member states for me would be the main element to mention here.
Interestingly, drug addictions also do not necessarily mean just drug-related problems. Together with Dr. Gabriel Fischer, we discuss substance use disorders, or SUDs, and their treatment. These are nothing less than mental health disorders, and they should be treated as such. So what usually comes first, the drug usage or the mental health condition?
First, we do have a genetic liability. Second, we have psychiatric underlying disorders. Very often, and I bring another point into the field, we have sex and gender different prevalences of psychiatric disorders. Like in substance use disorders, we very often see in boys and young adolescent males that there is a high prevalence of ADHD, attention deficit disorder, and in women or in adolescent girls, we see much more affective disorders.
So the both genders are affected similarly, but with different diseases.
Well, it is. We have a different prevalence of underlying psychiatric conditions, like more depressions on the female side, and a higher prevalence of ADHD on the male side. But still, and that's, I think it's very important, substance use disorder / addiction is still a male-dominated disorder in almost all of the substance-related spectrum. However, the women figures are increasing dramatically.
Of course, health issues are incredibly broad topic. So in one of the episodes, we also ventured into something completely different, topic of rare diseases. There are hundreds of diagnoses under this umbrella, and combined 30 million people in the EU have some of them. So they are actually not as rare as one might think. So I talked with Dimitrios Athanasiou, who's the president of Rare Disease Greece. He described quite dire differences between EU member states.
In rare disease, we call it a postcode lottery. So you live or die depending on which, let's say, postcode you have and which country you have. The truth is that we have very big differences. So if you are living, let's say, but like in every other thing, if you live in a country that it has more resources, then in theory, usually you have better access. And I will not say to treatment so far, to tell you the truth, not to medicines, because we don't have a lot of medicines. But even in the few ones that we have, yes, you have faster treatment, faster access to the medicine. So the one equality is definitely this.
I think all of our episodes show that European healthcare has both strengths and weaknesses. Let's address that briefly in this part of the episode. So there are some strengths to much of the European healthcare. First, we can be proud of the high standards of care. However, as we also said in the several of our episodes, there can be quite big differences between member states. EU can play its role in harmonizing these standards. Second, we also have a robust network of public health initiatives that allow for more prevention and education towards healthier lifestyles. In the EU, we are also leaders in innovation and research, with many ambitious companies and startups in healthcare. And one of the long-standing priorities in the EU is health equity. That is the fact that pretty much everybody can access urgent care if needed, without worrying that it will cost them a fortune. Of course, we also have some challenges to tackle. Across many member states, healthcare sector suffers from workforce shortages. Despite the fact that we have urgent care on high quality, healthcare inequalities persist, and depending on the condition, it can very much matter, say if you are in Poland or in Netherlands. Much like with different goods, Europe is also to some extent dependent on imports. Most of the drugs sold worldwide come from India and China, where production is the cheapest. As a result, Europe's supply of medicines is in the hands of a few companies. These are areas that legislators can work on in the coming year. And now, in terms of 2024, what major milestones have happened? First, the European Health Data Space Regulation was adopted. It allows for easier sharing and use of health data between member states. These initiatives will make it easier for patients to access their health data across the EU and support innovation in healthcare, such as the development of personalized medicine. The EU has also promoted innovation in healthcare and launched programs to support biotechnology and pharmaceutical research under Horizon Europe. Emphasis was placed on funding projects on rare diseases, cancer, and antimicrobiological resistance. In another area, the European Union has strengthened capacity of HERA, or Health Emergency Preparedness and Response Authority. This authority deals with health crises such as the pandemics and disruptions in the supply chains of medicines. Also, the European Commission has proposed changes to improve the availability and affordability of medicines. Now, there is a plan to promote development of generic medicines, which should reduce the cost of treatment for all. The Commission has also presented a European strategy for mental health. It includes increasing investment in prevention of mental illness, improving access to mental health care, especially for young people, and strengthening awareness of mental health in the workplace. Funding has also been presented for modernization of hospitals and the introduction of digital technologies through the Next Generation EU. Also, steps have been made in cybersecurity standards in healthcare to protect patients' health data from attacks. So let's see what awaits us in 2025 and beyond. Thank you so much for watching this special episode, and I wish everyone the best year ahead. In 2025, we will again have many exciting interviews in the EuroHealth podcast, so stay tuned.